Welcome to this episode of Healthy India. Today we're going to talk about in vitro fertilization, commonly known as IVF, which has had a huge impact on treatment of infertility in the last few decades. Infertility basically means the inability to conceive or to become pregnant after 1 year of unprotected contact. Infertility is common. Almost 20% of couples have been shown to have some degree of infertility. And it's stressful. It's stressful for the couple. It can be stressful for the family too. So to discuss all about IVF, as we commonly call it, I have experts in the studio for you. We have Dr. Renu Tanwar, who's the professor and IVF coordinator at the Maulana Azad Medical College. We have Dr. Renu Misra, who's a senior consultant at the Sitaram Bhartia Institute, heads the IVF unit, and was formerly additional professor at the All India Institute of Medical Sciences. And then we have Dr. Surveen Ghumman Sindhu, who is the senior director and head of the IVF facility at the MAMC group of hospitals. So I'll start with you, Dr. Surveen. What exactly is IVF, or test tube baby as they call it? People don't really understand. You want to explain that?
So let's look at the word in vitro fertilization and split it up. Fertilization means that there is a meeting of the male egg, that is the sperm, with the female egg, which is the oocyte. That normally occurs within the body, precisely in the tube. Many couples cannot conceive because that doesn't happen in their bodies. So when it doesn't happen in their bodies, you have to assist them by doing this particular fertilization outside. How do we do it outside? Is that we have to extract the egg and take the sperm and make them fertilize either in a dish or in a test tube, or sometimes we even inject the sperm into the egg. And this process of fertilization is completed outside. Once this fertilization is done, the resulting embryo, which is made either a 3-day or a 5-day, is put back into the womb, that is the uterus, where we expect that yes, this embryo will start growing. So what is not happening in the body of infertile couples, we do it outside by advances in science, and we try and give them the baby they want through this process.
So for some of you, in vitro actually means in glass. So this is really, that's why the term test tube baby is the fertilization. Typically, the fertilization is happening outside the human body in a glass petri dish or test tube. It may not be glass, maybe other material, but that's how the word came about. Dr. Misra, what exactly are the steps? Dr. Surveen briefly told us. How do we go about this?
In vitro fertilization, like Dr. Surveen explained, that it is fertilization outside the body. So we need the gametes outside, that means the egg and the sperm. So the sperms are easy to get because a man ejaculates the semen, and this semen is then washed and prepared to be incubated with the egg. The eggs are inside the ovary, inside the female body. So the eggs, you have to do a procedure to extract the eggs. Now in natural cycle, there is only one egg which grows. And if we remove only one egg, then we cannot aim at the kind of success we want from IVF, because one egg may or may not fertilize. So what we do is we give injections of the hormones which are naturally produced in the body, but we are given higher doses so that the ovaries grow more eggs. Now these eggs, some people think that we are exhausting the ovaries because we are removing too many eggs. But that is not true. These eggs are already in the active pool and they will degenerate anyway. So these eggs are grown with the help of injections, FSH hormone, and then they are extracted by a small procedure done under light sedation or short general anesthesia. We put in a needle through the vagina, which is ultrasound guided. It's not a blind procedure, and we suck out the eggs are in small sacs. You cannot see the egg without a microscope. So this fluid in the small sacs, or the follicles as we call them technically, they are sucked out, and then we hand them over to the embryologist, who then checks that fluid under the microscope to find the eggs, and then incubates these eggs with the sperm outside in the incubator to help them fertilize.
So, very nicely and simply explained, ma'am. Thank you. We move to Dr. Tanwar. And who actually is a candidate for IVF? Are all infertile couples candidates for IVF? How do you choose?
That's a very good question you have asked. Actually, not all patients require IVF. It is only very limited patients who require IVF. And usually the indications of IVF are either there is a tubal factor infertility, that means the tubes are not working, either they are blocked so that the female cannot conceive, or there is severe endometriosis where the ovaries have lot of, the ovaries grow big in size and there's collection of blood, that is known as severe endometriosis. So those patients, or there is severe male factor, then these patients are those ones who require IVF, or if the patient's reserve is very low, she has a poor ovarian reserve, those patients are, these are some of the indications that these patients will require IVF.
So, it's not that IVF is a panacea, it's a cure for all infertility.
No, no, not at all.
Only selected
Only
patients.
selected, very selected
Yes,
patients will require.
are the ones who should go for IVF. So, when you start talking about IVF, it's important to ask your doctor, go to the expert, the IVF expert, and ask them if you're actually a candidate for IVF. And one of the things, Dr. Surveen, about IVF is that people are always worried because you just described in one cycle, you stimulate the ovary, get the eggs, fertilize them outside and implant them. So, the issue is, you know, how many cycles does this go? What is the time span people should look at?
So, per se, there is no harm in IVF. People can go for multiple cycles, but the question is how many? After about 3 cycles, you need to analyze that are you on the right track, and somewhere you need to stop, and maybe if her eggs are not working, take a donor egg. If the sperms are really bad, suggest a donor sperm. And generally after each cycle, the cycle should be analyzed on whether you are on the right track. You can do multiple cycles. There are patients who have done more than 3 cycles. But what is recommended is about 3 cycles, and then you need to change your treatment plan for something which works better. So, by the time you've done 3 cycles, you should be able to analyze what is wrong and what needs replacement. Is it the egg which needs replacement? Is it the sperm? Or is it the womb? That what is not working in the body?
So typically you would give a try of 3 cycles at least and then review, but you should critically analyze each cycle to see what did not work.
Yes.
But what are the usual success rates, Dr. Misra? I mean, there's a whole lot of controversy about this because people claim all kinds of success, but you know.
People even claim 100%.
Yeah, but the science is not
nothing like 100%.
so exciting. Yeah,
there's nothing, I always say there's no 0% and there's no 100% in real life. But anyway, when we talk about success, we need to understand what does success means, because success can mean different things to different people. For IVF people, success is usually pregnancy rate. You know, if the patient gets pregnant, for us, it is a success. But for patients, usually it means live birth rate. So it is very important to, I mean, there are others also, parameters also, but these are the 2 which are most important. So if we say that, and then success again depends on so many factors. The most important is the mother's age. That is a single most important determinant of the success of IVF. Then of course, even the sperms, the quality of sperms. Besides these, also how long the couple has been trying. So duration of infertility. What is the basic reason for which IVF is being done? So all these factors are very important in deciding the success of IVF. But let us say the younger lot, usually we say less than 35 years. So we don't really have a data, you know, like pan-India data for, I mean, I could tell for my center. But taking cue from other countries like UK has a registry. We are now having a registry which is in process, and maybe next year I would be able to tell you our own result, our own success rates. But like I'm just taking UK an example. So the latest release figures of success rates in less than 35 years, which are sort of taken as young women, is 32% live birth rate, which means that pregnancy rate would be around 40-45%. Yes. This is for young women. But as
this is for one cycle, or this is
for one cycle?
Yes.
So this is per cycle or per transfer, and then as the age is going to increase, certainly the pregnancy rate goes down and the miscarriage rates go up. So it is not a static figure. So the younger the woman, the more likely is
in an ideal environment, in an ideal candidate, or you would probably find success rates of up to 32%, right?
That's live birth rate.
Live birth rates, I'm talking live birth rates.
Pregnancy rate,
Yes.
if a woman
About-
is 25 to 30, can go up to 50-60%.
Okay. But live birth rates will be
Live birth
typically in
rate
this zone, although they can
generally
vary.
reduce 10% because that's about, in
Yes.
young women, 10% is roughly the pregnancy loss or miscarriage rate.
So that's a considerable improvement over what used to be the case maybe 20 years ago. I think IVF, like many other parts, many other areas of medicine, has made huge advances with better skills, better technology. Dr. Tanwar, nothing comes without a price. As we all, in medicine, we all know there is a side effect to even the smallest drug.
Definitely.
So what are the risks of IVF that our patients face?
Yeah, the risks are there. Whenever we are stimulating the lady, we have to be very careful. What dose we have to give. Don't have to overstimulate the lady. So one of the commonest, one of the things which risk is there in IVF is ovarian hyperstimulation syndrome. So if that means the ovary gets larger in size, there are many follicles, multiple follicles. So that one risk is there where the ovaries enlarge in size around to 10 to 12 centimeters, multiple follicles, multiple eggs are there, and later on the patient can have ascites and all that complications. That one which we really dread, but this is seen in less than 1% of the cases, and now with newer regimes and protocols, this is becoming lesser and lesser. Another risk and complication is that multiple pregnancies. So that they are the two more
Most
complications.
important, the things that we
multiple
need to be
pregnancies
aware of.
and OHSs.
Right. These are the typical complications during IVF. A lot of patients ask us, what about the children who are the result of products of IVF?
Yeah.
What is their long-term outcome? Is there any data on that?
So, before children, I talk about the pregnancy because that is directly impacting the children.
Yes.
So, these pregnancies are, yes, much more prone to miscarriages, to preterm labor, to antepartum hemorrhage, and other risks during the pregnancy. Post-pregnancy, we see that the children who are born from frozen eggs, frozen embryos, they are slightly larger for date. So, all the complications of delivery for a large for date baby occur in them. There are some studies, very few, which say there may be some cardiometabolic risks in these babies. And there are also some studies which show that elderly males, when they go in for IVF, autism may be slightly increased. I say slightly because the message should not go that yes, there is autism with IVF. It's a very slight increase, but yes, a significant increase has been seen. But at the end of the
But
day,
that really depends if the father is in the older age.
in the
right?
older
Yeah,
age.
so that's a separate.
But at the end of the day, for the woman, one of the biggest risks, I think long-term risks, is the depression out of a failed IVF cycle, as she never gets out of it. So it requires prolonged counseling. You have to really understand your patient, because I feel that is one of the biggest long-term risks for a woman. It changes her life when she undergoes multiple failed IVF cycles.
I completely agree with you, because a lot of our patients, endocrine patients who have polycystic ovarian disease, etc., when we transfer them to you for further management, those who succeed are very happy, and those who don't, they really feel low, and some of them are struggling with that. It becomes a vicious cycle because their metabolic parameters also become worse then.
Yes.
And in India, the pressure for sometimes to produce a child or have a child is very high on the women. One liner for you. Who is not a candidate for IVF? You would say, no, don't come to my room, you're okay, go to my colleague.
First of all, age. Like she said about paternal age. So sometimes, you must have seen pictures, sometimes a 70-year-old couple having children. That is not right. Not for the baby, because the babies can have more like autism, other birth defects, Mongolism, Down syndrome. And then the parents will not be there to look after the children. So age, that is why legally we cannot do IVF in a woman more than 50 and a male more than 55. That is one major no-no.
So age is one no-no.
Yes.
Is there any other thing that where you don't accept patients
Another thing we have to see that if the patient is not physically fit or
Yes.
medically fit
Yes.
to bear the pregnancy, then why should you actually stimulate
Yes.
and make her pregnant? So that is another area that you must actually you must evaluate the lady before doing any fertility procedure, not just IVF, whether she is fit to have a pregnancy. So that is also important.
So I think especially because a lot of disorders are happening or occurring at a younger age in Indians, metabolic disorders, again I'll go back to my own zone where they occur in the 20s very commonly.
Yeah.
And the age at pregnancy is going up while the age at onset of metabolic disorders is coming down. So we are seeing a lot of patients who are actually patients and when they go for IVF instead of being just healthy
I
young
would
women.
just add here that like I said about age and she said about autism and even other birth defects a little higher in IVF pregnancies. Probably the reason is not IVF, but the reason is that those people would not have got pregnant,
Yes.
you know, naturally
Yes.
with those old
Yes.
eggs and sperms,
Yes.
which we are getting them pregnant.
Very true, very true. So we're coming to the end of this program, but the most important question, IVF is just one aspect of assisted reproduction. What other key advances have taken place in this area?
The advances are many. Actually, there's ICSI, which is along with there, where there's severe male factor at times, and then the motility is very low. At times, we have to do ICSI in these kind of patients. Then there's a laser hatching which has come up. All these are newer techniques which are coming up. All these. And these are some of the things which are newly coming up for that.
So it's not just IVF, there are lots of other things. Even within IVF, as was discussed, there are lots of advances.
Yeah.
Well, thank you very much for enlightening our audience, our viewers, about all the aspects of in vitro fertilization, commonly called IVF, something that very few people actually understand. And thank you for simplifying this. Thank you very much.
Thank you so much.